Now, we've talked about just how important it is to speak with your children about what's going on with the coronavirus and what's going on around the world. But that conversation can be especially difficult if you have kids who have developmental disabilities. Here to help with that, we're joined by licensed psychologist Dr. Nicole Berkins. Good morning, Dr. Berkins.
Good morning.
Doc, what are some of the specific challenges parents are facing right now if they have a child with autism or any other developmental disabilities?
Yeah, these are families who are certainly struggling more than many families are, although everybody's under more stress and with the change. But children who have autism and other kinds of developmental disabilities tend to struggle with communication, which makes it more difficult for them to understand what's going on and for us to explain it to them, tend to have higher levels of anxiety as a result, and change in general just can be more challenging for these kids. At the same time, families are dealing with their regular care providers not being able to come and provide care, kids being out of school, them not having their regular therapies. So certainly a lot of added things for these families to be dealing with.
And how can parents help these children understand things like, of course, washing your hands more, staying at home, and kind of being out of their normal routines?
Yeah, it's important to talk about these things with kids at their developmental level. So at the level that they can understand what's happening. And sometimes that means using really simple language and words like we would with a very young child.
Yeah.
And sometimes that means even using pictures or things like that to help them understand. We can create little picture stories. We can use schedules and visual written schedules or picture schedules to help them understand new routines. And that's a really important thing for parents and families to be thinking about is there's been a lot of change, but to establish some general routines that kids can start to adjust to, especially now that we know that schools are going to be closed the rest of the year. We're going to continue to have these sheltering in place, social distancing things in place now for a while. Families can really start to look at how do we want to provide some structure? How can we give these kids a schedule and a routine that becomes predictable for them and helps them cope and reduces anxiety? And it's important to think about too for things like hand washing. Modeling is the best way to do that. Instead of just trying to explain it with words, to make sure that we're going to the sink with kids, we're washing our hands with them, helping them to see what we want them to do, singing a song, whatever we need to do to help them to get into those routines and to provide a good model for them can be really helpful too.
Dr. Berkins, always a pleasure. Thank you so much for joining us this morning, and thank you for, of course, your insight.
Thanks for having me.